Dr. Michael Selmer here, the Caring Vet. Have you ever wondered what happens inside our exam room? Well, today we're going to give you a sneak peek. We'd like you to meet Rocky, so follow me. So this is Rocky and Michelle. And Michelle is one of our veterinary assistants, so she might be someone that you see when you come here. And Emily's the one holding the camera, so you can't see her right now, but she's with us. So I wanted to talk to you a little about what happens when you guys come to visit us. So when you first come to our office, you'll notice that you're greeted at the reception desk by one of our technicians, veterinary assistants, or our office manager, Eileen. And at that point, they'll walk you into one of our exam rooms. One of our assistants will then come in and ask you a brief history and get some background and get some vital signs from you, so I get a basic idea of what's happening before I come in the room. At that point, they'll leave and inform me of what's happening, and then it's my turn to come in. So I'll come in, and you'll always see me carrying my trusty laptop because our medical records are electronic, which means that everything is stored in the computer for easy access, and to be sure we don't lose them, we have redundant backups that are on and off site. So first we'll start off, and I'll ask Michelle, who's our owner, if there's any concerns she has about Rocky, main complaints or issues that are occurring now. So Michelle, anything going on with Rocky today?
Yeah, he still keeps licking his feet. I can't figure out why. That's my main concern. He's eating and drinking fine. There's no other issues with that. Going to the bathroom fine. I just can't seem to figure out why he keeps licking his feet.
So the most important part is that I address the client's concern with her dog first. Even if I find other things wrong, which I will address, but the first concern is always my client's concern with their pet. So when we look at Rocky's feet, you'll notice that they are very saliva stained, all four, which means that he's spending a lot of time licking and chewing on them. You'll also notice he has a lot of saliva staining around his face, right? So we know that he's been itchy in those areas on his body, or at least he's paying more attention to them. So typically, I will then follow up with a bunch of questions. And I'll ask questions like, what's his tongue color? So for example, when we look at a dog's tongue, I'm going to show you a quick reference. We can get a lot of information in Chinese medicine based on what the tongue looks like. Whether it's red, pale, lavender, wet or dry, spotted, all those mean different things in Chinese medicine. And actually, if you want to learn more about Chinese medicine and how to make a Chinese diagnosis, you should check out my book, The Best of Both Worlds, An Integrative Guide to Healthier, Happier Pups. And you can download that from Amazon as we speak. So we're going to look at Rocky's tongue, and if you come closely, I want to just take a peek from the side. And you can almost see that it has a little bit of a lavender tint, and it looks kind of dry, right? Now, if I open his mouth to look, he's going to pull that tongue back and it gets more purple. And you'll see that happening, right? So we don't want to open it up and stress him. We want to look at it in its natural state. Also, if you notice when we look in Rocky's mouth, we'll see that he has, his teeth are not great. He's got some tartar accumulation. So at some point, we're going to talk about dental hygiene and oral care in this visit. So we're going to look at that tongue. And we're also going to talk about what Rocky's constitution or personality is like. So in Chinese medicine, there are 5 different elements, and each element is associated with a different organ system. And each of those is associated with a personality trait. So if you notice when we walked in and Rocky was growling a little bit, right? Well, he was kind of protecting his mom in the exam room. That lends to be towards a wood type of constitution, which is of the wood element. And it's associated with the liver. Now, interestingly enough, in Chinese medicine, the liver is the organ that controls the feet. So, for each time I get a symptom or a sign that will help lead me to a diagnosis, I give it a card. So we already have 2 cards for the liver, right? We have him chewing on his feet, which is controlled by the liver, and his constitution is also wood, which is associated with his liver. So in my mind already, I'm kind of worried about that liver and what's going on with it. Next, I'll ask about how his spirits or his shen is. Is he happy, sad? Is he anxious? Is he depressed? Those also will help me determine his overall health. His activity level, how he's sleeping at night. Any temperature preference in the home. Does he like to seek out warm areas in the house or cool areas in the house? How's his appetite? His thirst? Urination habits? Is there any coughing, sneezing, vomiting, or diarrhea? Any stiffness or weakness anywhere? And also, very important, I always want to ask the owner if they think their dog is in any discomfort. Is it having any pain? So we'll ask the owner for a pain score from 0 to 10. 0 being no pain, and 10 being excruciating pain. We'll also ask for an overall score for how they think their pet's overall health is, also from a 0 to 10. 0 being in perfect health, and 10 being that they're very, very concerned that this issue might be life-threatening. After we gather that information, I put it all down into my notes on the computer, and we'll move on to a complete physical exam. So you want to make sure that your pet is examined in front of you from the tip of the nose to the tip of the tail, so that we cover everything. Our patients can't talk to us, so we rely very heavily on the owner giving us the appropriate historical information and what they're seeing at home, because there are eyes and ears outside the exam room. And then what I will see, smell, touch, feel, and as I examine little Rocky. So again, let's go back to the front end of this little guy, and we're going to start with his nose. And we look at his nose, and you can tell it's really nice and moist. It has a nice sheen to it. We don't see any discharge. He seems to be breathing well through it, and through both nostrils. Then it's easy enough just to go right up to his eyes, and we just take a general look at his eye. And you can see the whites of his eyes are very white, and the cornea is clear. He looks bright and alert, and you can see he's a little nervous about what I'm doing, and that's part of that, that constitution. He doesn't like me being in charge. So we work our way back. We already looked into the mouth, so we'll take another peek. You can see the gum color. When I press the gums, you'll see they turn white and then go right to a pink. That's called capillary refill time. So that tells us how well the perfusion of blood is into the gums, which is important also. We'll then feel for glands in the submandibular area under the jaw, and we'll take a quick peek at the ears. And you'll notice these ears are nice and pink, no redness, no discharge or swelling. And I'll always stick my nose in there and take a sniff for any odor. And you want to make sure both ears are checked, and then we work our way down. Just like us, neck pain can be an issue in dogs, so we want to make sure that we examine the neck. And I'm always palpating or touching to see if there's any areas of pain. Then we'll move the head in different areas to see if the dog is resistant at all or does not have full mobility. And you can see Rocky's pretty good here. I can get that nose all the way around to his body without any issue. Up and down, and no resistance. Now I typically do my exam in order from front to back so I can make sure that I don't miss anything. So I'll then check out those front legs. And we want to make sure that there's no pain or stiffness in these joints. So we'll flex the entire limb, extend the limb, and then I'll extend the whole limb forward. Now you can see he's a little resistant to that. And then I'll go back. We'll also cross over. So he's a little tight in his shoulders. So right up in here, in his scapulas, you can feel that there's a lot of tightness. So Tui Na is a Chinese medicine technique which is very similar to shiatsu massage and chiropractic care. And I'll sometimes use that to try to help loosen up these shoulders and these muscles. So that would be a treatment modality that we could offer. As we move back, we'll feel in the chest for more lymph node areas as well as under the arms. I'm gently palpating the chest and back to feel for any other lumps or bumps. Then I will palpate down the back of the spine. And if you notice, I'm running right down what I would call the bladder meridian. Down this meridian are different acupuncture points that are associated with each organ system. If you were to see Rocky flinch or twitch at a specific spot, I would then associate that spot with the organ system that I'm worried about. But you can see he's pretty comfortable with all that. So at this point, then I'm going to want to feel his belly. His belly should be nice and soft and supple. I should be able to feel the kidneys. Feel for his liver and spleen, his urinary bladder, and make sure I don't feel any abnormal masses. Make sure the belly's not too tight, can indicate pain. Then I'll work my way back to the hind legs, and I'll check his pulses. So when we feel pulses in Western medicine, we want to make sure that the pulses is synchronous with the heartbeat, and it tells us that as the heart pumps blood out, I'm getting an associated pulse with it. But in Chinese medicine, the pulse has meaning too. Whether the right side is stronger than the left, whether up higher close to the body wall is stronger or weaker than as I go down the leg, all gives me information. So as I'm feeling his pulses, they're pretty well even. I'm not feeling much difference on either side. So they feel very balanced. Then I'm going to go to a point on his hips called Zhenjiao, which is an acupuncture point that we use as diagnostic for hip pain. So you can see when I press on that, he doesn't really move, which is great news because he probably doesn't have any hip pain. Then we'll check those back legs like we did the front. And we'll flex that leg up, rotate that hip in all directions that are comfortable for the dog so that we can make sure that he doesn't have any pain in that hip. And then I'll move down to that knee. And we'll do a draw test on it to make sure that that cruciate ligament is nice and tight in there, which it is. Then as I go down to the toe, I'm feeling the leg all the way down to feel for lymph nodes, swellings, or heat or cold. Then we'll flip that back toe and make sure that he puts his foot upright. And that tells me that the signal from his brain is reaching his foot in a timely fashion. So if he were to have a spinal injury, that reflex would be delayed. So we'll check the same thing on the other side. Make sure that hip isn't painful. We'll go forward, rotate out, palpate down the leg. Do a draw sign on that other knee. It's nice and tight. And check his proprioceptive response on that leg. And it's also adequate. So we've really looked over the outside of him and we don't see anything that's alarming besides what we've been told by the owner. So next I'm going to use my stethoscope and make sure that the heart sounds healthy, that I don't hear any murmurs or abnormal sounds, that the heart rhythm is normal or sounds normal. I'm going to listen over all three valves on both sides of the heart. So the area, the pulmonic valve, the aortic valve, the mitral valve, and the fourth valve, which is the tricuspid valve. And you'll hear different ones better on either side of the chest. And then I'll move along the quadrants of the chest and listen for any abnormal breath sounds or absence of breath sounds. So we can see Rocky looks pretty well. And before I came in, if you remember, our assistants and technicians did get our vital signs. So we did get accurate heart rates, respiratory rates, temperature, and pulse readings at that time as well. So at this point, I'd gather all my information and I'd say explain to the owner what we're seeing and what our concerns are, and try to develop a plan of diagnostics as well as treatments. So based on the concern that I have with Rocky's liver, being that they control the feet and that's his constitution, and as well as him being itchy, in Chinese medicine we call that wind. So just like when it's windy outside and the trees will shake, when Rocky's itchy, he will scratch or lick and his body is shaking. So that's what that analogy came to be. So those are the things we're worried about on an Eastern front. Now just because I'm integrated and I'm going to put those philosophies together, well, I can't help but be concerned about his liver enzymes. So we're probably going to recommend that he get some blood work so I can check those out. The strength of Western medicine, or one of them, is diagnostic testing. So if the liver enzymes read that they're high and there's an abnormal liver issue going on, we have a metric that we can follow and track besides just what we see. So blood work is important to be part of the diagnostic plan, as well as urine testing, because we can see bilirubin in the urine, which is also a great indicator. You'll also notice Rocky keeps yawning. Well, it seems he's probably really comfortable with his exam. So at this point, I would typically leave the exam room and go formulate a diagnostic and treatment plan. In that plan would be a list of all the services that I recommend. And I believe my job for you is to be a good healthcare provider and help you make good medical decisions for your pet. It is not my job to judge what you can, want to, or will spend on your pet for its health care. But I can present the options and all the options that are available to you, and then you have the choice to make the decision on what healthcare options you want for your pet. So I would lay out that plan with all the associated costs, and I would explain to you at the time, I would never want you to leave my office with any regrets. Never do any service or treatment or diagnostic that you are not comfortable with. If you leave my office unhappy, it doesn't help anybody. So make sure that you take the time when you go over an estimate with me or with your veterinarian, that you choose what you want to do at the time and what you don't want to do. Easy enough here, whatever you agree to, will have you sign consent and authorization to allow me to do it. And anything you disagree to or don't want to do at that time, and for whatever reason might be, it doesn't matter. That's for you to decide. Then you'll just sign a declined consent form, letting us know that that's not something you want done at that point. And then we'll make sure that you never leave without an unanswered question. So you need to make sure that when you're at your doctor's office, all your concerns are addressed. Now you'll probably notice, we've been doing this for probably more than 5 or even 10 minutes. So in a normal veterinary visit that might only be that long, we haven't even started to treat the pet or start the diagnostics. So make sure you have the time at your visit to talk to your veterinarian and make sure you understand everything that's happening. Without the time and without communication, we're not a good healthcare team. To make a good team, you need the doctor, the patient, and the patient's owner. And we all have to be on the same page. Well, I hope you'd enjoyed your little sneak peek into our exam room today. And I hope you want to learn more about me, my practice, and our staff. And you can do that by visiting us at our website at www.thecaringvet.com. We'll see you next time.